I used to prescribe stretching where the patient would lie on her back on the floor on a foam roller that's the length of the spine and bring both arms out. And I no longer use that as a part of an intervention, but I did before, and what I thought I was doing was stretching or elongating the pec muscles, perhaps putting some stretch to the nervous system, perhaps just reinforcing a neutral spine posture. But because I don't find indications for that, I'm not using that kind of intervention these days. The point I want to make today, however, is that if you're doing both arms at one time, you're almost always not getting to the furthest extent of what you're trying to achieve. If you go with both arms out at one time versus one arm at a time, you will notice that you are able to take that shoulder joint much farther when you do one at a time. So if the intent of that stretch is to actually stretch the pec muscle, then you're not going to be able to really stretch the pec muscle on the right if you're doing it on the foam roller or on the left. If the problem is on the right, if there was an actual lesion in the muscle and the pec muscle is actually tight, which people think things are tight all the time and they're not actually tight, we would do it unilaterally, either maybe on a weight bench with gravity taking it down where there's plenty of room to go before you hit the ground, or more often in standing. The same premise applies to the kind of corner stretch of the wall. When you're using both arms at the same time, you're not going to get the full excursion that you usually would using just one extremity at a time. So I want people to understand that concept, but at the beginning, you need to understand the concept of why you're doing something, right? If the goal is to just lie on the foam roller, waste 3 minutes and feel good, that's fine. But if you actually think you're stretching something, you have to question if you're really stretching it. To legitimately stretch a tissue, you need to take it as far as it can possibly go and then push the envelope a little bit. That's how we lengthen tissue. And that brings up another point that I've been thinking about a lot, which is how people always talk about how it feels so good to stretch. And what I think they fail to recognize is that if we actually had to lengthen tissue, if you were in a cast, or if you did have a muscle tear and now there's some scar tissue that's prohibiting full excursion, full flexibility, it doesn't really feel that good to put that tissue on stretch. It can be sometimes painful, but so many people think they have muscle problems and it feels good to stretch when most of the time it's not a true muscle problem and the muscle is not actually tight. And we can of course test to see if things are tight, but just feeling it in a muscle when you move it is not the definition of having a muscle that's actually too short. So think about the reason you're doing things, of course. Is it muscle? Is it joint? Is it tendon? Is it ligament, etc.? And then if you're thinking about doing something bilaterally, reconsider if you're actually going to get a better effect or an effect at all from the movement or stretch if you do it just one extremity at a time.